the biggest aha is that fluoride is not a nutrient. It's not. And so you hear every once in a while, I'll hear stories about somebody who says, oh, I got off the fluoride toothpaste and then I had a bunch of cavities. So I got to get back on that stuff. Well, it's not the fluoride. Like maybe fluoride was a temporary Band-Aid and we need to get to the root cause of why you actually had the cavities, but it's not because of a lack of fluoride.
Are you going through life blind? This is Eyes Wide Open with Nick Thompson. On this podcast, we share knowledge and stories that build human connection while elevating stigmatized societal issues such as mental health, holistic wellness, culture, free speech, and more. All to ensure we show up in the world with our eyes wide open. Hello, everyone. Welcome to Eyes Wide Open. Our guest today is Dr. Toni Engram, DDS. Dr. Toni is a certified biological dentist, integrative health coach, and the founder of the Flourish Dental Boutique. After her own struggles, Dr. Toni decided to dedicate her practice to focusing on full body health and preventative and safer oral care. So thank you for joining us today. I'm super excited to have you on.
Thank you so much. I'm excited to be here.
Yeah, I'm super excited. I'm glad that we were able to get connected. As I was telling you a little bit beforehand, and people who have listened to this show, I make my own toothpaste for over a decade, based on just researching myself and learning a little bit about oral care. And so this is kind of a tried and true personal guest for me to have you on today. So I'm excited to talk about this topic and learn about your experience and your expertise.
Love it. Love it.
Yeah. So before we get started, I'm dying to know what you wanted to be when you were a little kid and how that led you to where you are today.
I was like most little kids. I wanted to be everything, just depending on the day or the week. Probably the longest stint, I wanted to be an actress, which is funny because I'm probably not a very good actress, but it worked out well for me because I was on stage a lot in high school and did, high school plays and things like that. And my drama director introduced me to her son, who is a little bit older. So I didn't go to school with him. And I wound up marrying the boy. So that worked out fine.
Wow. That's a pretty cool story, actually. So what does he do now?
Well, he's more into acting than I am. He owns an animation studio.
Oh, how exciting. That's cool.
So he's CEO of Brazen Animation here in the Dallas area. And so he gets to do a little bit of acting, a little bit of drawing, and gets to lead all these stories and hopefully change some of our kids' culture for the better.
Oh, well, I think we could definitely use some of that. What kind of stuff does he work on, if you don't mind me asking? Or you could I'll interview him next.
Right? No, he would love that. He would love that. He's better on camera than I am. Grew up with a theater director as a mom. He works on a lot of faith-based stuff, but really his goal is to not specifically be faith-based, but to just tell really good stories that have meaning and purpose, and to help really change the culture through kids' entertainment. And so they do some things that are faith-based and some things that are faith-adjacent. They do some video game work too, because it's just cool and fun. So they've done some work on Fortnite and some of those things too.
Very cool. Yeah. Well, I do think that storytelling and bringing things into sort of pop culture and entertainment is the way to make it digestible, especially when it's a complex topic people don't really want to dive into themselves.
Absolutely. Absolutely.
So how did you end up as a dentist, and then you had a shift where you switched from more, I'll say, Western or traditional to be a little more holistic about it? So I'm dying to hear your story on how you ended up as a dentist and then what caused that shift. Yeah,
well, I really just wanted to be normal. Really, it's, I got interested in healthcare. All of my family is in healthcare in one way or another, and I enjoyed it. I did pretty well in school, so I was like, why not go to med school? And then med school didn't seem like a very family-friendly option. At the time. They did a great job of letting us know what the divorce rates were for people who went through med school and did residency and internship.
No wonder we have a shortage of doctors. Like they're getting you on the way in.
It's no joke. Yeah. I didn't want to be on call. My mom worked in a hospital growing up. And so she was on call sometimes, and I didn't really want that life. So dentistry made the most sense. And I'm a very logical girl, clearly. But man, it got so discouraging over the first few years because I realized that all I was doing was this, what we call the drill, fill, and bill model of dentistry.
Mm-hmm.
And if I wanted to make money, I had to keep drilling. If I wanted to keep the business open, I had to keep drilling. But I didn't feel like I was really helping anybody because patients would come back and they'd have the same problems again the next time around. And then we'd drill some more.
Yeah.
So thankfully, I was faced with a personal crisis of sorts. I just got really, really sick, and it wasn't dental related, but my career sure did have an impact on my health. Because it was 2011. At this time, I was working full time as an associate dentist for somebody else's practice. I had my first kiddo already, so I had a toddler at home. And I was building my first practice from scratch. I was doing a scratch startup in addition to working full time and being a first time mom and all the things. And I wasn't eating all that great. I wasn't really taking care of myself. I was eating on the run and just started getting super, super sick and had tons of digestive issues, enough that I usually suppress things for a while, but it was enough that I couldn't suppress.
Human nature, yeah.
Right. And so finally I was sick enough. I started losing weight and started having, some really crummy symptoms that the doctor did a colonoscopy and found that I had Crohn's colitis, which is just an autoimmune condition that affects the gut. Oddly enough, the more I learned about it, the more I learned that it's really an inflammatory condition caused in part by a dysbiosis in the gut. So the bacteria were all kind of out of whack. Things were out of balance. And I was given the very typical Western medicine response to that diagnosis, which was, here are your medications.
Yeah.
You're going to be on these until...
Forever.
Either forever or until they stop working, and then we'll put you on stronger medications. And oh, by the way, there's a 40% chance you're going to need surgery at some point to remove all or part of your colon.
Oh my gosh.
I was like, whoa.
I bet you couldn't wait to sign up for that.
Yeah. Like, I don't have time for that. I don't think you understand. I've got a kid at home. I'm starting a new business. Like, I don't have time for that. How do I get rid of this? What do I need to eat? What do I need to do to actually be better? And the guy looked at me and was like, Toni, your diet has nothing to do with this. And he said that with all sincerity, that the inflammatory condition in my gut had nothing to do with my diet.
How does this happen? Like, because I firmly believe, and I told you a little bit, like I'm been into holistic health and wellness, and like I have lots of doctors on this show that have had different but similar journeys where it's like, wait a minute, this isn't right, or this doesn't make sense, or
it just sounds nonsensical, doesn't it?
Nonsensical. And then you hear this story and your doctor's literally telling you like your diet has nothing to do with your gut issues. Like, is that ignorance? Is that negligence? Is that just like he's conditioned through his training, which is, I've heard you talk about before, but yeah.
I think part of it is that they don't want people to feel guilty, like they did this to themselves. So I think part of it is like a weird attempt at being kind, but I want control. I want to be able to control what's going on in my own body. I know there's only so much that you can control, but a lot of it you can. And so that's exactly what I did. I said, thank you very much. I'll take your medicines for right now because I'm kind of scared to death, but let me see what I can do to actually get better. And that's exactly what I did. Thankfully, the medications put me in remission really quickly. And then I did all the research that I could to become my own doctor because I didn't believe my doctors. And I started feeling much, much better. And then it was it was my second pregnancy. The OB that I was with during my second pregnancy kind of helped me with a game plan on how to get off the medications before my second daughter was born. And I've been in remission ever since.
But well, that's really, really good to hear. That I was going to ask that.
It was amazing. But what was the biggest gift was that as I was doing all of the research and all the homework, and as I was going down this journey and feeling lost and not knowing what to do, I realized that what I was treating in myself was really no different than what I treat in my patients every day. So, we said Crohn's disease, it's an inflammatory condition caused in part by a dysbiosis in the gut. What I treat is tooth decay and gum disease. That's all about inflammation and a dysbiosis in the very first part of your gut, which is your mouth. So if I could figure out how to heal myself and how to feel better and get well, then I really felt like I had the ethical responsibility to figure out how to do the same thing for my patients. And that's what really led me into, the links of oral systemic health and getting in the right groups and then finding biological dentistry and the evidence behind that. So that is the long road that led me right here.
I have to bring this up because it's come up recently on a few of my episodes. And I did so last week's episode, which will be a few weeks by the time this comes out. But last week's episode, I had realized that it was my 3-year anniversary of starting the podcast. And so I wanted to do what are the 3 things? So I just started reflecting on them, what are the 3 things? And one of them, one of them was do your own research. You've got to, and I tell people this, you've got to own your own health. Your doctor's going to be a data point, but your doctor doesn't know how you feel. Your doctor, in a lot of cases, especially here in the States, that Western approach, you've got to kind of monitor your own wellness and symptoms and what's getting better and what's getting worse. And, is it a net positive if you're going to be on a medication for a long period of time and stuff like that. And so I realized during COVID, which we don't believe that in the past, but this whole doing your own research concept just became completely blown out of proportion. You're a Looney Tune conspiracy theorist if you read something, which is crazy. Because I was taught in school to think critically and read. So how did you decide, I'm going to do my own research? And did you get any pushback from your actual medical doctors at that time as you were going to kind of go about your own healing path?
That's a good question. So doing the research, no, because I just didn't tell them. I just grew up in a world where you just do what the doctors tell you to do.
Most of us.
I was just silently kind of stubborn. So no pushback doing the research. It wasn't until I wanted to get off the medications and I felt like I needed their help and their guidance to get off the medications. So I did see my gastroenterologist while I was pregnant the second time. And he was like, I don't think that's a good idea. I know you've been in remission, but the chances of you having a flare up while you're pregnant are real, and I don't think they're worth it. And so I just didn't agree. And so that's why I talked to my OB about it. And my OB was like, all right, if this is what you want to do, then here's our game plan. You do it, you time it here. He's like, do you feel good? I was like, yeah, I feel great. I feel amazing. My first pregnancy, I had symptoms in the first trimester, second trimester, third trimester, I was totally fine. He's like, all right, beginning of third trimester, because my goal was get the medication out of my system in time for breastfeeding, because one of the medications was excreted in breast milk.
Okay.
So I wanted that out of my system by the time she got here. And he's like, okay, so as long as you feel good, taper off, wean yourself off third trimester. And here's a game plan. Worst case scenario, you have a flare up. You go on steroids. You can do that while you're pregnant. It's not ideal, but it's also not the end of the world. And if you want to risk it, I'm here for you. We'll make it happen.
See, that's a good collaborative doctor. Isn't it supposed to be collaborative?
It's beautiful, informed consent. And that's what I want every day to give every patient is true informed consent. And what I hope all healthcare providers are giving their patients, whether you agree or not, because he didn't agree with me. Whether you agree or not, just give me the pros and the cons and let the patient make the decision.
That I don't know why, and I get why it's hard because I like you grew up, you trust the doctors, and I don't think people get into being a doctor for the wrong reasons. Mostly, of course, there's always something, right? But like
Right.
when you want to help people or heal people or whatever that passion inside of you that drives you to whatever your medical profession is, like that's a good
Yeah.
thing. That's something that should be celebrated, right? And something that you should take pride in. And so when I hear, and I've had doctors like this where it's almost like becomes combative because you're asking questions, right? About a medication or a protocol or whatever that is that you're going to do. And so I don't understand where medical care of your own health stopped being collaborative. That's the part that just blows my mind. And it's almost
Well,
like a doctor, yeah, doctors tell you and then people want to be told. So that kind of creates the
right.
dynamic, I guess.
I think two dynamics are going on. I think that medical school and dental school too, you're so bombarded with all the things you need to remember. You're bombarded with what to think that sometimes you unlearn how to think. And so you combine that
That's
with we've got good intentions and sometimes we really help people and we really do well and it kind of creates a bit of a God complex. So you forget how to think and you've got a little bit of a God complex and you lose all humility in the fact that we don't know a damn thing, really and truly. That our patients know way more about their bodies than we do. And we just forget, we lose all humility. And so I try to remind myself and remind my team that hey, it's all about the patient and what they want to do, their choices, their bodies. And I think sometimes that takes more reminding than others.
You know, I think you said that so well, and I admire that because I can see the God complex in some of the doctors I've seen over the years and all of that. One thing that you said that I found really interesting in another podcast, and I kind of wanted to another podcast you were on, I wanted to get your thoughts on it here. So my journey started with fluoride. I was like, why the hell is there fluoride in my toothpaste when I found out that it was a neurotoxin? And so I started making my own toothpaste probably, I think it was 2012, which was very simple, right? And by the way, after that, every time I'd go to the dentist, keep doing what you're doing, keep doing what you're doing, looking good, keep doing what you're doing.
Love it.
And yeah. And so you had mentioned in another podcast that I listened to that you were quickly, and you mentioned this a second ago too, like quickly told not to believe the conspiracy theorists about things like fluoride, not to believe, other things about health. So they very much want to control the thought, right?
Right.
So what was your experience at that time when you were kind of being told what to think and what not to think and who to listen to and who not to listen to? And then obviously your own experience changed that, but how did you kind of take it at the time? And then when did you start questioning some of the more traditional dental and oral care practices?
Well, it definitely was frowned upon in dental school and is still frowned upon by many of my colleagues. Any thoughts challenging the status quo, especially around fluoride. I think we're slowly starting to be okay talking about mercury as a neurotoxin.
Crazy.
It's bizarre. So there's still a lot of pushback on the fluoride debate. And I don't know what to tell you other than the older I get, the less I care what people think.
It's the greatest gift. I say that to people because some of the stuff that situations I put myself in to have a controversial opinion or to like be a leader in something that people aren't ready to hear yet. I find myself in those situations all the time because I critically think about everything. And I have a supernatural thirst for the truth, which sometimes I wish I didn't have. And I think that when people do speak up, and I remember, gosh, like I felt like the scientist in a disaster movie that just realized that there's an asteroid coming straight for Earth that's going to wipe everybody out. And they've got like their papers, and they're like, "Oh my God, you guys aren't going to believe this. There's an asteroid coming, and no one cares." And I just remember being like, I learned about fluoride, which sent me on this whole path of like health and wellness and all of this stuff that I had no idea about.
Yeah.
And I just remember trying to tell people and they just thought I was crazy. So it's like, how did you keep as you get older, I'm like, I'm unapologetic myself. I don't really care what you think about me unless I do something that hurts you, because I don't want to do that.
Right.
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 But how do you kind of build that scar tissue or that callus where you know that something is right, or that you're doing something right, or at least questioning something from a good place, to let it build character so that you don't care? Because I think a lot of people have a hard time sort of building that self-worth and that willingness to stand against something that is so mainstream.
That, I think it's a really important conversation, because there is, and I don't know how. I mean,
You were forced to, kind of.
I was forced to. I cry at night. I drink a little.
Mm-mm.
I'm kidding.
I was like, me too.
I think just as a society, we have grown a bit fragile with what others think about us. I think it's just, man, if you don't have what you know to be true, and if you don't have the courage to stand up to what you know to be true, then to me, you have no integrity. And I don't know how you sleep at night. So I would rather sleep at night with myself, knowing that I say what I know to be true, and I've spoken what I really believe. And that's on both sides, by the way. So I actually get, just because of the circles that I travel in, because of the audience that I have on social media, I get as much or more criticism from the crunchy holistic people than from the mainstream people, because I'm probably not going to say that all fluoride in all doses for all people are necessarily damaging. I think there probably is a middle ground. It's just that we can't freaking control the dose because it's in our water.
Right.
And so we don't know.
Everything is nuance.
Right. Yes. Everything is nuance. I'm also not going to be like a couple of my colleagues who are really popular online, who say that every root canal is bad and evil and going to cause you, serious illness. I'm not.
We're going to talk about root canals too.
I'm all for it. I'm all about it. But I'm not going to take that this is what has to be true for every person. And so I literally had a lady who deselected herself as a patient in my practice because I told her that a root canal was an option for her tooth. And the
Which you're collaborating with her, right?
Bless her crunchy Karen little heart, offended her that I would say the words root canal to her. She's like, I can't believe you would recommend a root canal. I was like, I didn't say I recommended it. I said this was an option for your tooth.
And by the way, if you didn't present that option, I mean, you wouldn't be doing your due diligence.
Exactly. Again,
and if she didn't
both ways.
Yeah. That's crazy. See, I agree with you. And I think the internet has polarized people so much that everything is black and white. And the reality is nothing's black and white. And your health isn't. And by the way, depending on your DNA, your genetics, and a lot of other things, you might be able to handle more fluoride than somebody else, or less fluoride than somebody else, or have something, a different reaction to it. Just like some people are allergic to some things and other people are not. It's really nuanced.
We all know that Uncle Ted, who was 85 and smoked a pack a day till the day he died and then keeled over of a heart attack. But other than that, he was healthy as could be. Everybody's different. So yes, there is nuance in everything, and I love the nuance, but it also makes for lively conversations online.
It does. Well, I mean, people online are crazy. And I say that with experience myself, but I always look at it, and I tell this to people in the comments sometimes, where I say, I'm like, you know what? I think you should look yourself in the mirror and ask why you felt the need to say this to someone. And I mean, I feel like I'm the internet's dad. Like, I say that all the time. I'm like, I'm the internet's dad when I'm like, hey, I remember in kindergarten, I learned if I can't say something nice, don't say anything at all. And that applies to you when you're 40 years old commenting on an Instagram post as well.
I freaking
But, I think what I appreciate about the work you do and the work that a lot of the other people, I've been really in like this. Usually I have a mix of stuff, but lately I've really been into this side of the podcast because I do think for for 13 years, I've been screaming at the top of my lungs, and you almost a similar time frame, even though we have different stories. And I think to myself, I'm like, well, actually now there's like space for it. There's actually people that do want to talk about the
Yeah.
nuance of your health, the nuance of how we treat disease, how we treat illness, and how. I think there's so many ways that this has shown up now where we have, especially in the US and probably North America, like we want a pill for everything. And it's
Right.
so easy, and we're trained that way. And we're trained to I remember one last thing, and I'll get back to my actual question. This was several years ago now. I dated a dentist for a little bit. And
Bless your heart.
I mean, she was, bless her heart, she was handing out root canals like they were candy. I mean, I was just like, oh, so they need a root canal. It'd be like someone would ask her about a tooth thing. It'd be like, oh, you need a root canal. I'm like, how do you know? You haven't looked at anything. Like, anyway, so. But what I wanted to get at is now that there's more of a open space to have these kinds of conversations, what are some of the key messages that you want to get out to someone who maybe is just kind of opening their eyes a little bit to preventative or holistic oral care? What are some of those things that you can share with the audience who's still listening because they're curious to learn?
Well, I think probably if they haven't been in this world before, the biggest like aha is that fluoride is not a nutrient. It's not. And so you hear every once in a while, I'll hear stories about somebody who says, oh, I got off the fluoride toothpaste and then I had a bunch of cavities. So I got to get back on that stuff. Well, it's not the fluoride. Like maybe fluoride was a temporary Band-Aid and we need to get to the root cause of why you actually had the cavities, but it's not because of a lack of fluoride. Fluoride is not essential. And I have tons and tons of patients in my practice. Very few of my patients use fluoride at all. And I've got tons of healthy patients in my practice who have not used fluoride for years. So that's a big one. And then kind of on the opposite end of things is, man, if I could just get one message across to the world, it would be that you don't just have bad teeth. You actually can do something to heal your teeth, your mouth, your microbiome. It can be done. And so just that mindset, that encouragement that your bodies are actually designed to heal. They just need to have a few more of the right tools.
Right. That's so true. And that's what I think is unfortunate about a lot of the illness that we have. And I know there's room. I'm not, anti-medicine or whatever, but there's room for that. But I also think, to your point, if you can get to the root cause of something, and it might be a little more work and it might take a little more time, but if you can really solve that, your body can heal. I mean, we heal from unbelievable injuries, unbelievable, internal, external, all sorts of stuff. We're made to heal and evolve and grow. And if you give your body the best chance to do that, you can really live a much more fulfilling and healthy life. And I think I think they're opening to that, but I think a lot of people don't really know that or feel that way.
I agree.
Especially if they have chronic health issues.
Yeah, absolutely. You start to feel a loss of control, and then you kind of get in this mindset of, I don't have control.
Yeah, and I just want something to control, and I can do this every day or take that every day or
right.
Yeah, that's so true. That's well put. I want to talk a little bit more about like biological dentistry versus the drill and fill or traditional model. Can you kind of explain what that is first? I think we know the drill and fill model. You got to that, and I should have asked this earlier, but can you explain in your own words, like what is biological dentistry and what are some of the common practices of that?
Yeah, so just the high level is we're going past that germ theory of disease where one germ causes one illness. We're going beyond that really to more of a terrain theory of disease. So what are we doing to support the biological terrain, meaning the health of your entire body, Or what are we doing that's contributing to it not being well? That's really what we seek to do in biological dentistry, is we want to remove any of those oral contributors to systemic illness, whether that's infection, whether that's toxic materials. What are we doing to remove those barriers to health and support a terrain that's healthy and balanced and can thrive?
What a concept. I can't even imagine someone wanting to do such a thing. What is from your perspective, I want to talk a little bit more about um like preventative stuff, right? So let's say, so I don't think I've had a cavity since I started doing like my own oral toothpaste and stuff like that. What are some of the things that you would say people can do to sort of better protect their oral, and why is that even important, right? Your oral health.
Yeah. Well, when you're looking at oral disease, and that's mostly we're talking about tooth decay and gum disease. There are other issues that pop up here and there, but those are the big ones. And so the things that contribute to those are like too much acid, so an imbalanced pH, an imbalanced microbiome, so the bacteria is kind of out of whack, and inflammation, absorbing nutrients, those kinds of things. So what we can do to support those, to make sure that we stay healthy and that our mouths stay healthy, is we can try to balance the microbiome. So we can do that by doing a little bit of really good oral hygiene, which doesn't take a lot of fancy ingredients or fancy products. You're a testament to that. It can be really simple, but disrupting the biofilm is what we want to do when we brush and floss and take care of our teeth, which is exactly what you're doing. We want to make sure that we're not using super harsh chemicals that will kill the beneficial bacteria. And if we need to, then we need to add probiotics back in. We want to do the tweaking to balance the microbiome. And then I think it's nice to have tools that we can use, ingredients that we can use to help things along when our diet isn't creating, or if we've got other health issues, then it's not creating the most healthy mouth possible. Then we can cheat a little bit with the things that we're using in our mouth. So I really like xylitol as an ingredient. And that is controversial in some circles too. So we can talk.
I'd love to hear that, because I think that's in the mouthwash I use.
Is it? I love it. I love it. That and hydroxyapatite are both really, really effective, and have an excellent safety profile when you compare it to anything that you'll find in like a big box retail product. Mm-hmm. So those are a couple of really good ingredients, but it really does, like, it's simple. It's controlling your diet. It's controlling what you eat, how healthy you are. Is your gut healthy? Are you breathing well? All of those things work together to create a healthy mouth, and a healthy body also helps create a healthy mouth so that you can avoid me a little more.
Mm. Yeah. I mean, who likes going to the dentist, right? Maybe some of your patients do, though. You alluded to this, the health of the mouth and the breathing. And this was something, again, I heard you speak on another podcast, and you talked about mouth breathing, and you gave me, unfortunately, I'm a mouth breather, and I've been I have like a new nasal thing to open up my nose when I sleep, and but I'm still a mouth breather. I think it's just years and years. And I was kind of shocked because I hadn't ever thought about being a mouth breather at night when I sleep. So how does breathing impact your, overall health, I guess is the best way to put it?
Man, it's huge. It's the problems that we talk about in adulthood are different than the problems we talk about with our kids. With our kids, it's even more impactful, because if they're breathing through their mouths at night, then it can have a detrimental effect on the growth and development of their jaw. They can actually have a mouth that is too small for all of their teeth. It decreases salivary flow, all of these things. It can really wreak havoc on a kid's health. In adults, it's also can wreak havoc, but we're more talking about that shift in the microbiome because the mouth will dry out at night. And so the bacteria that will thrive are going to be more of those pathogenic bacteria because your saliva and the good bacteria aren't naturally washing away plaque on the teeth at night as it should.
Oh, man.
Have you tried mouth taping?
So step one was the nasal thing,
Okay.
right? Because I was like, I don't want to mouth tape and then like suffocate myself or be uncomfortable and wake up. And I know you're not going to suffocate yourself. I'm being hyperbolic.
Well, no, I think you should be careful with mouth tape. You definitely want to know that you can physiologically breathe through your nose before you start keeping your mouth shut, because we like for you not to die in your sleep.
Yeah, that was my general idea. Is like I don't want to die in my sleep. But yeah, so I have. Do you use mouth tape?
I haven't because my husband's so jealous of me. I sleep like a baby and I sleep with my mouth closed. I'm sorry.
I'm jealous too.
I know. It's like a superpower I have. When I'm tired, I sleep.
I don't understand people who can nap and just fall asleep at night. Like to me, it's you are.
Oh yeah, that I don't have that superpower. If I nap, I'm screwed that night.
Me too.
Yeah.
If I nap, it's over. Like I can't even do the 20-minute, like close your eyes, power nap kind of thing without. Either I won't be able to do it, or I'll fall asleep, and then that's it for the whole day. Yeah. So I guess you're not both.
Have you had a CBCT yet to look at your airway?
So I actually just went to. Do you mean what is a CBCT?
It's like a 3D scan of your head, and it's like a 3-dimensional X-ray, but it's just for the head, and you can actually look at your sinuses and look at the size of your airway to see if there's something impeding nasal breathing, or if it looks like there's no impediment. So then, mouth tape away, use your nasal strips, all that good stuff. But if there is something blocking the airflow, then you would want to know that, because then that helps guide you on what direction to go next.
I'm going to bring that up because I actually just went like 2 months ago to see an ear, nose, and throat specialist that my girlfriend had seen and recommended. Mm-hmm. I do have a deviated septum, and it gets like, especially this time of year, like summer, it gets to the point where it's almost closed. Like I can't even get Q-tips, COVID testing, flu testing. That's the most painful thing in the world if they go up on the right side. So I know I have that, but I don't know about what else is going on at all. So I'm going to bring that up.
Right. Yeah.
And that was called the CBCT scan?
CBCT. I don't know too many ENTs who have them, but most biological dentists will. And a lot of dentists who are just placing implants will have a CBCT.
Okay. So I'm in Chicago, like the city, not downtown, but like in Chicago, like 2 miles from downtown. I found a holistic dentist when I moved down here in 2015, 2016. Mm-hmm. And she sold her practice. And I feel like I don't have any proof of this, but I haven't been in like a year, so that's bad. But I felt like the person they sold the practice to was like slowly getting away from like the holistic style of stuff. Of doing things. And what I had felt, and it's funny you say this, because now that I'm thinking about this in our conversation here, I felt like it's slowly stopped being collaborative. Mm-hmm. Where before it would be like, okay, I'm going to recommend this. I think we should do, at one point I was like, I think we should try, cleanings every 4 months, because I hadn't gone for a while when I first got there, and all of this stuff, because I didn't know people like you existed, right? Or people that weren't going to, throw out root canals like they're candy existed. So I need to really figure out who I'm going to see here in Chicago so that I can feel better about it.
I can't think of somebody in Chicago off the top of my head. I know there's got to be somebody good up there.
There has to be. You would think.
Yeah, there's got to be. If not, just make a trip to Dallas.
Might have to do that. Might have to do that. So I want to talk a little bit about mercury and cavities and stuff like that. I mean, I could ask 100 questions, but what can what do we know now about mercury and fillings and treating of cavities that we maybe didn't know 10, 15, 20 years ago?
Well, surprise, surprise, mercury is a neurotoxin. The sweet little people who made hats 100 years ago would use mercury in their felting process, and they just didn't know what they didn't know, so they used their bare hands to do this, and some of them would then go cuckoo, and then that's how the term Mad Hatter came about. And so that cute little character that you see in Alice in Wonderland is really just somebody who is mercury toxic. So we've known this for a really long time. What I was taught in dental school was that the old silver fillings, which I still had to place. I had to place one for my board exams. Still, I think they ended that a few years after I graduated, so they don't have to do that anymore. But I had to do it for my board exam. And what they taught us in school is, the filling is 50% mercury and 50% other stuff. So other metals, silver, tin, those kinds of things. And that when you mixed it together and placed it into a tooth, that the mercury was then bound, it chemically changed, and it could not escape. Well, unfortunately, we know now that it does escape a tiny little bit. You can even go on YouTube and just look up smoking tooth videos, and you can find multiple videos where they show that anytime you apply heat or friction to those old silver fillings, you will get a tiny bit of off-gassing of mercury vapor. So that's one thing. Little tiny micro exposures, probably not the best for us. Again, exposure to mercury vapor over time, and mercury likes to settle in organs and fatty tissue, one of which is the brain. Not amazing for us. Well, if you think about those tiny little micro exposures, and thankfully most dentists aren't placing these anymore, unless they're doing a lot of mission work in third world countries. They still are, but for the most part, here in the States and Canada, UK, not placing them. So what happens if you've got mercury that's released with heat and friction? So you drink coffee, you brush your teeth, you grind your teeth, you chew gum, all of those things, tiny little bits of mercury vapor. What happens when one of those fillings needs to be replaced? What is your dentist going to do? We're going to take a high-speed drill at 800,000.
Let it rip.
That sucker.
Jesus.
And let it rip. And so if we do that with no protection, then you, the patient, that sweet little dental assistant who is probably a female of childbearing years, and your dentist who's been working in that shit for who knows how many years, is all going to get this huge plume of mercury vapor exposure, which is not good for anybody in the room. JADA, the Journal of the American Dental Association, did a study back, it's been quite a few years now, but it was basically a celebratory study of looking at the mercury levels of dentists over the years. And they were celebrating the fact that, and I can't remember, this was like maybe 2016-ish. Okay. And they were celebrating the fact that dentists only had slightly higher mercury levels than the general population who ate a whole bunch of fish. And this was well into the 21st century, that we still had more mercury exposure than the general population. But yet, it's fine. It's all fine. There's nothing to see here.
It's so crazy because, I think like everything's science and right until it's not anymore. Mm-hmm. And that's where it's like, when it's not, why don't we just stop trying to hide it and save face and just say it's not? We've learned, we've evolved, we've changed. That's okay. That is science. It's okay to change and learn more as we evolve.
I think that there are so many people who are either scared of litigation or scared of public humiliation, that they just can't admit it until literally the generation dies off. Literally, like, good and
Yeah.
well, that's what the last 5 years has taught us, that there will be no admission of wrong
Oh no.
until those people are no longer with us, until they have moved on, crossed the rainbow bridge.
Well, I mean, we could probably talk about the last 5 years for a whole nother podcast, but to me, what has been so, and in a sense, I'm grateful because I think a lot of the stuff we've been talking about has been an output of what happened 5 years ago. And
Yes.
to this day, we still hear these stories and these narratives. And to me, it's just, and again, like, I'm not that smart. I just like question, well, why to everything? Why would someone say this? What is someone trying to sell me? What is the reason for this? That's the only thing. And I learned it early. Like my uncle told me when we went to Six Flags Great America one time, he's like, we're going to go left because everyone else is going right. And when everyone's going right, you should wonder why no one's going left. And I just take that with me. I think about it that way all the time.
I love that. Yeah.
Yeah. Like, why is everyone going right? Why is no one going left? Who wants people to go right? Who doesn't want people to go left?
Mm-hmm.
Same kind of thing. And I think the silver lining to the last 5 years and everything we've gone through is that it kind of woke people up that like, hey, just because someone's quote an expert or an agency of some sort doesn't mean that they have all the answers, and that science changes. It evolves, and that's okay. And we would be in a much better position, in my opinion, now if we would have let it evolve and we would have learned with it instead of just holding the line on a narrative that has not translated well over the years, we'll just say.
Yeah. Oh, totally agree.
So few more things I want to talk to you about. I have really bad TMJ. I know a lot of people that suffer with TMJ. Do you have any tips, tricks, recommendations on how you treat people? Because it's one of those things, and I did see someone who like wrote a book about it for a while, and then COVID hit. We didn't get to finish my treatment, spent a lot of money and time. And so I've been through a little bit, but like to me, it's one of those things that, I could get surgery for theoretically, but it's one of those things I think a lot of people suffer with in some way worse than others. But what are some of the things that you recommend about just the jaw and jaw health and
Yeah, it can be such an impactful issue because it's there's something about pain in and around your mouth that is always more intense, I think, because it's just literally right in your face, literally in your face. Like you can't get away from it and ignore it when it's bugging you. So with TMJ issues, very similar. It is tough, and it's tough to manage because it's inflammatory and it is hard to get to one root cause of the inflammation. So it depends on what's going on. If it's an imbalance in the bite itself, then sometimes it's adjusting the bite and being, strategically adjusting the bite, which means sometimes adjusting the teeth even. Sometimes you can wear appliances, and there are certain appliances that actually hold your jaw in a position to where the muscles don't want to clench down. And so it relieves some of the pressure that way and holds the jaw in a more ideal position just to relax all the ligaments and the muscles around the joint itself. So
I think I need that.
That's usually my first line of defense. If your jaw is hurting you and you don't have a major airway obstruction, because again, I don't want to stick something in your mouth if you're already obstructed and are having a hard time breathing through your airway. I've had some people who do well with body work. I've got a referral partner place where I refer a ton of people to, and it's like this beautiful combination of massage and chiropractic, even though nobody's a chiropractor. They're like craniofacial kind of stuff. I don't know what kind of magic they do, but they do magic. So if my magic's not magicking, then I let them do their magic, and they can find ways to release tension in pressure points and things like that. What else? Sometimes surgery is an option. I personally don't do that, and obviously that's going to be a last resort. And sometimes it's intense orthotic devices, not just a normal kind of device that I would make, but like a TMJ specialist has special orthotic devices that they use. And again, like we try to start with the easiest and then work our way to the most complex solution only if and when we have to.
Right.
And some people, for women, sometimes women do well when they work with a BHRT provider and get their hormones balanced. And then I've had some guys who do well with just an anti-inflammatory diet.
Okay. I'm actually having someone, doctor on, I don't know if they've scheduled to talk about inflammation, because that's another thing that I think the last few years, the role of inflammation in disease and overall health is another thing. And like, I've never heard anyone until now mention inflammation in relation to TMJ issues.
Oh yeah. Yeah.
So
it's huge.
Yeah. It's crazy how much inflammation in your body is impacting you in ways you don't have any idea about.
Yeah. And it's going to show up, like it finds the path of least resistance. So for you, it may show up in your TMJ. For somebody else, it may show up in their gums. Their gums bleed every time they're stressed out, or something's going on health-wise.
Mine do that too.
When are you coming to Dallas again?
I know, right? I know. Well, it's funny because like my gums used to bleed a lot when I was younger.
Mm-hmm.
And I was always told that means you got to go to a cleaning. That's what that is.
Mm-hmm.
And I don't floss as much as I should. I don't know many people that do, but we should all floss more. I'm going to tell you how infrequently I do that.
No judgment. No judgment.
I don't want to be humiliated here after all. But I think, it's when I'm stressed, I start up on this left-hand side. I've noticed that. It's not consistent. It's actually very inconsistent.
Yeah.
But I've noticed that. So I've never thought of that being stress.
Yeah.
Like being real.
It definitely can be. It can be. And stress of any kind. Like it can be a chemical or physiological stress, not necessarily an emotional stress. So if you've got diabetes and your blood sugar is not really well controlled, then we'll see more inflammation in the gum tissue. If you're not sleeping well, then that's going to spike your cortisol levels at night. You're going to have more bleeding gums then too.
Okay. That's good to know. What do you think, two more questions and then I could talk to you all day, I think, but what do you think is the most important thing for people to do for gum health?
An anti-inflammatory diet, whatever that looks like for them. For some people, it's tons and tons of plants. For some people, it's tons and tons of animal products. I personally think it is tough to get all of the nutrients that you need if you are 100% vegan. Mm-hmm. But I think well-balanced, good anti-inflammatory diet is really the best thing you can do.
That's good to know. I've been trying to do an anti-inflammatory diet, and every time I start making progress, like consistently, I feel so much better. And then the weekend comes, or an opportunity like, tonight the Bears are playing. Right. We're really excited in Chicago. I'm going to eat some bad food and I'm going to feel like crap tomorrow.
Yeah.
So, but no, I can definitely tell in myself the difference when I'm eating an anti-inflammatory type of diet.
And it doesn't help when you're you, like I am also, we're in a culture where the culturally significant food, like the feel good get together food, is not always super healthy. No. Like I've been to Chicago. I've eaten my way through Chicago.
That's what you're supposed to do. I would put our food up against anyone in the world. And, a little fun thing that I learned about it, the reason Chicago has such good food and so many different ethnic foods is from the World Fair back in the 1800s, because so many people migrated here from across the world for work. So when it was in Chicago, all these little pockets of all these different ethnic groups came and they started restaurants and stuff, and they've just been passed down through generation and generation. And so that's why we have, whether it's true or not, I don't know, but it seemed
I believe
cool.
It sounds believable.
Yeah, exactly. Exactly. One last thing I want to ask you, then I'll flip it over to you. And this is more for me. I don't know anyone is wondering this, but like, what is your take on like veneers or like even like tooth extraction? Like, is that something? Maybe that's two questions. I'm sorry. Let's talk about tooth extraction, because I feel like a lot of times that's a pretty common recommendation. And then I'm just curious what you think about veneers in general for your oral health.
So with extractions, what do you want to know? What do I think about them?
Yeah, like, is there like, there's obviously a time and a place for everything, right? But do
There's a
you
time and a
like,
place. Yeah.
yeah,
And we do, when the time comes and you do need to have a tooth removed, then I have very specific ways that I like to do it to help you heal a little bit faster. Again, calm down some of the inflammation that kind of makes you feel not amazing the next day after you've had a big procedure like that. So we'll do a blood draw and we'll get PRF from the blood sample, so that we can get PRF is just platelet rich fibrin, and then that has all like the growth factors and healing factors in there. And so we place that in the extraction site along with some ozone to help the area heal faster and hopefully heal better, feel better faster. And then we do some IV vitamins afterwards to kind of help your body detox from all the, whether it's infection that we're stirring up or just our medications that we're using, the anesthetics, just to help the body recover the way that it should a little bit faster and a little bit better. But yes, sometimes extractions need to be done. And a lot of my patients will choose to have a tooth removed versus doing a root canal. And I know we didn't get to talk about it a ton, but there are risks with having root canals, just like with any other procedure. And it requires, like we've talked about earlier, it requires good informed consent. So anytime you've had a root canal done, you are essentially creating an area where the bacteria, the microbiome in the area will shift and will change, and it will create a bit of a tax on the immune system. And so some people will look at the risk, especially if you go down all the rabbit holes online. Some people will say, okay, if those are my two options, because sometimes those are the only two options. Like, hey, the nerve of this tooth is dead or dying. It's infected and causing an issue. Your choices are either do a root canal on the tooth or have the tooth removed. And for some people, it's a really tough decision. And for some people, it's a real easy decision. And that decision is to get that tooth out of there. And so that's sometimes what needs to be done.
And the danger. Oh, go ahead.
Oh, nothing. I was going to move on to veneers. So keep going.
Oh, okay. No, one quick follow up on that. What makes, in a nutshell, I guess, what makes root canal so dangerous? Is it just that you're opening wounds and the microbiome and all of that? Or is there something specific that makes them so not dangerous, but, not the first option?
It's the fact that you can't 100% guarantee that you have removed all of the bacteria in the root canal system, because your tooth is really, you don't have just one canal per root. You've got your tooth is like a sponge, and you've got all of these tiny little accessory canals all over the place. So it's difficult, if not impossible, to completely disinfect the tooth. And you're removing, by necessity, part of the root canal procedure is the blood supply of that tooth gets removed along with the nerve. So it stops hurting, but it also has no blood flow. Blood flow brings oxygen to the area. And if there is no oxygen, then all the microorganisms that are naturally living there are going to shift from oxygen-loving species to those who thrive with no oxygen. They're like the deep, dark, creepy, crawly bottom feeders of the microbiome. And so the theory is that tax on the immune system, that shift in microbiome creates enough of an imbalance, enough of a strain on the immune system that it could potentially impact health in other areas. And so people do notice, like, hey, it's had a tumor on one side of the body, just so happened to be the same side that I have a root canal on. Again, I'm not saying that one directly causes the other, but there is definitely the worry online in the internet spheres. And so some people will say, okay, any hint that something like that might happen, and I'm getting the root canal out of there.
Yeah. Yeah, that makes sense. Makes sense. Your elevator pitch for or against veneers?
I like this question because I am a I'm a terrible salesman of cosmetic dentistry.
Mm.
I really like mouths with character. I really do. I think like you can do, I've done beautiful veneers before. It's really not super hard to do a beautiful set of veneers because the lab does all the hard work.
Yeah.
So veneers can be really beautiful and can be life-changing for some people. But if everybody's getting veneers, then everybody's smile starts to look the same. Just like online, everybody's face starts to look like a Kardashian. Everybody's butt starts to look the same. Everybody's nose starts to look the same. So it's just not my favorite. Like if my daughter, I've got almost two teenagers. One's about to be 13 and my oldest is 16. So
Good luck.
thank you. Pray for me. If my oldest were to ask me to get veneers, I would say 100% no. 100% no. Yeah. Because in order for me to do veneers well, I would have to remove some tooth structure. Most of the time, like there are some cases where you don't have to remove a ton of tooth structure, but you remove a little bit of tooth structure, and just like any kind of cosmetic work, it takes some maintenance. It is not forever. So it may do really, really well and last 20 years, but I'd put money on the fact that you're going to have to replace at least one of those veneers within that 20 years. And if you get veneers when you're 18,
kind of like 3 replacements.
Right?
Best case. Wow. I didn't know that. I thought they lasted forever, I guess. I never thought about it much, but
forever in medicine, 20 to 30 years, that's about all you can expect.
Yeah.
That's forever in medicine.
That's a good point. That's a good point. Well, that was a little indulgent for me. You know why? Because I see more and more people with them.
Yeah.
And it catches that, and like people whitening their teeth with insane types of whitening strips. I'm just like,
I know. And we're on camera all the time. So you better believe when I see my own teeth on camera, I'm like, oh, wouldn't that be nice if my laterals were just a little bit longer? Yes, we all do this. We all do this. But embrace the character that God gave you is what I would say.
I love that answer. That's not what I was expecting, but I love that because I think you're right. Like, of course, if you chip a tooth, I chipped a tooth, I had to get it repaired. Like, you know, of course, do some stuff there, but you embrace your smile. It's literally unique to only you.
Yes.
So,
yes,
I love that. I love that. Before we tell people where they can learn more about you and Flourish and working with you, I'll give you a chance to ask me anything if you have any question you want to know about me or anything.
Yes. What's in that toothpaste you're using?
Oh my gosh. So I was using I still make my own, but I also use the one from, it's called True Eden, is the one from the nurse that I mentioned was one of the first guests on the show. I get that because it's easier, but mine was just baking soda, coconut oil, and then peppermint or spearmint essential oils, and they were food quality.
Love it.
And organic. Yeah.
Love it.
And this one, let me pull this up really quickly because I'd love to get your thoughts on this actually.
On True Eden? I don't know if I've used that one before.
She's in Texas, actually. She's in Dallas. I think she's in Dallas.
No way.
Swear to God. Yeah. Yeah.
Never? I'm going to call her.
You should. It's TrueTRU-Eden.com. And
True.
Right on her homepage is our podcast episode. She's the best. Her name is Leslie, by the way. Leslie, the toothpaste lady, is what she goes by on social. But her ingredients, her story is like so moving, very moving. You probably have a lot to talk about actually, because she's a registered nurse, and I remember she told me, she's like, I went back to what I was taught in school about like researching and things absorb in the mouth first before they go to the rest of the body, and she just like kind of worked similar to how you just started exploring stuff. She's great. Let me find these ingredients really quickly because I know she's got oil of oregano in there. So I've been using these, and I keep my own. I travel with my own.
Oh, she's got a couple.
Yeah, so it's sodium bicarbonate, which is baking soda, glycerin, xanthan gum, hydrogen peroxide, organic spearmint, or peppermint, depending on which one you want,
Mm-hmm.
oil of oregano, coconut oil. So it's just 7 ingredients.
Love it.
Yeah.
I approve. I have no issue with those.
Well, I was going to ask you. Thank you. Should I be using something else? Is there any? And then I promise yeah, thank you. I'll shut up. Is there any toothpaste that's sort of mainstream out there that people could get that you would recommend?
Yeah, I say if you've got to go with a big box store, then look for something. Actually, even at Target, I've found some of my crunchier, more holistic brands in Target now. So just look for something that ideally doesn't have fluoride, doesn't have foaming agents like sodium lauryl sulfate. Those aren't necessary and can create some allergies. And try to stay away from stuff that has like chemical antimicrobials. Like you don't need triclosan in your toothpaste. You don't need stuff that's killing that many germs in your toothpaste. In the stores, well, in my office, I sell a couple of brands. I really like Risewell. I really like the transparency of their ingredients. Like I know if something comes up, I can get one of their founders on the phone and get them to talk to me, which is incredible. Boca is like a fan favorite with patients because it has a similar feel and taste to the big brand toothpaste. So usually if they're switching from a Crest or Colgate, then I can get them to be okay with the Boca.
That's good to know because a lot of people that I try to transition to this or making their own, they don't like that it's such a
very different experience, a different user experience, let's say. Like you're used to it being gritty. You're used to it being super, super minty, like makes you feel cool when you breathe in. And you're used to having some foaming action. The foaming action is the big difference.
That's the big one, I bet.
Yeah.
Which is one of the things you're saying you don't want people to have in their toothpaste.
No, I mean, there are like a coconut-based, I think it's decylglucoside. It's like a coconut-based foaming agent that has fewer allergic issues that I don't have a problem with. I think is fine. Okay. And then some people don't love glycerin. So if you see rumors online that glycerin makes the other ingredients not absorb into the tooth, that's false information.
Okay.
So good. Glycerin's totally fine. You'll still absorb what you want to absorb if there are, more active ingredients in there.
Okay. Well, this, again, I love this conversation. You have been a delight to talk to, and I'm grateful for you spending extra time with me and sharing your expertise. Where can people connect with you on social media, or if they want to come see you at Flourish, your dental boutique, where can they find you and get connected with you?
Yeah, absolutely. So online, probably the easiest place. I'm most active on Instagram, so you can find me at Dr. Toni Engram on Instagram. I'm on YouTube also, just maybe not quite as much. My website is www.flourish.dental, and we've got people who travel all the time. So if you just want to come in for a week and get your stuff done, or come in for a few days, get your work done, and head back to your normal dentist at home, then we can accommodate that too. We'd be happy to see you and show you some Southern hospitality.
I love that. You may see me at some point. So again, thank you so much. And I want you to know, and everyone listening, those links are all in the show notes. So you don't have to go anywhere other than the show notes, and you can click and connect with Dr. Toni. So thanks again for coming on and sharing your expertise. And I'm grateful for the work that you're doing, and you're spreading your knowledge out there in a good way. So thank you.
Likewise, Nick. Thank you.
Thank you for joining us on this week's episode of Eyes Wide Open. If you enjoy the show, the best way to support us is by sharing or dropping a review. For more information and content, check out engagewithnick.com or find me on Instagram at nthompson513. Don't go through life blind. Do the work so you can show up in the world with your eyes wide open.